Starting with the frontal bone. All right, so here's our skull. You know this guy. I've used him before in the other video. All right, we have what we are referring to as the frontal bone, right? It's all of this whole anterior portion, your forehead, okay? Now, we are looking for the supraorbital foramen, all right? Now, from going over table 7.1 already, we know that foramen means hole in the bone, okay? And supra is kind of like superior, and orbital is the orbital cavity. So we can break that Latin down and look for the hole above the orbital cavity. Okay, so here's the orbital cavity, and here's a hole on the frontal bone above it. Okay? So this right here is your supraorbital foramen of the frontal bone. We always need to say of the, and then say what bone we are finding that marking on. Okay, that's to ensure that I know what you're looking at. So there are two of them. He's just a little broken on this side. All right, so you have one supraorbital foramen and another supraorbital foramen. Okay, of course, because we are symmetrical. Okay, and that's all you need to know for the frontal bone. So boom, done. All right, now on to the occipital bone. Now the occipital bone is the most inferior and posterior bone in the skull. Now the way that I view it is I take my skull and I grab it by the jaw and kind of bring it up like this. So we're looking at the underside, okay? But everything up here is anterior because it's still the face. We just kind of brought it over here. And everything back here is posterior. So that makes this whole back region the occipital bone. Looking at our things to know sheet, we need to find the foramen magnum and the occipital condyles. So foramen magnum, that's that hole again, okay? Foramen means hole in the bone. So hole in the bone on the occipital bone is right here. And it's magnum, big hole, okay? So this right here is the big hole in the occipital bone, or the foramen magnum of the occipital bone, okay? Now the occipital condyles are kind of just smooth surfaces, all right? Occipital condyles, there are two of them, and they are like dog ears, kind of outlining the occipital, the foramen magnum of the occipital bone, okay? So these little portions right here, all right? So those are the two markings that you need to know for the occipital bone, all right? Hopefully you're still with me. Again, make sure that we are saying, when I ask you, okay, what is this? You answer occipital condyle of the occipital bone, all right? If I'm asking for a foramen or a canal or something that is hollow through the bone, I'm going to use a little tag like this and just kind of make it go through the marking, okay? So if I have a little tag going like this, this is going through the foramen magnum of the occipital bone, and that would be the complete answer, all right? So that's something to expect for the post-quiz. Okay, so we mastered two bones, hopefully, and we can move on to the next. I'm actually going to skip the temporal and the sphenoid and the ethmoid, and I'm going to jump down to the mandible and the maxilla, which are found on the second page of your things to know sheet. So I'm going back up to the anterior portion of the skull, and I actually have to get a different skull, so bear with me for 1 second. It's easier for me to show the mandible if I have a detached mandible. This guy, he's connected, okay? So This is a plastic model, actually, so we can be rough with him. But for the mandible, the lower portion of the jaw, right? Okay. We are first going to find what's called the coronoid process. All right. The coronoid process is this right here. All right. This little bump, little protrusion moving upward, okay? Moving superior. This little guy right here is the coronoid process. Next, we have to identify the mandibular condyle. So we move posteriorly, and we can find condyle. It's the same word as we saw on the occipital bone with the occipital condyle. Now we have the mandibular condyle, and we're looking again for that smooth, bumped up surface, and that's what we have right here. Okay, so you have your mandibular condyle moving posteriorly, and your coronoid process moving a little bit anteriorly on the mandible, okay? Then we have what's called the mental foramen. Now, mental foramen are the two holes on the anterior side of the mandible, all right? So, this guy and this guy. Now, there's two of them, of course, because we are symmetrical. And on the real bone, I can actually put my needle all the way through, okay? So it actually holds mental foramens, okay? Mental foramen of the mandible. Please don't call them the mandibular foramen. That is incorrect. The mandibular foramen is actually somewhere else, but we don't go over it, all right? Also, something to make sure that you're recognizing as you're moving through these markings. It was the mental foramen and the supraorbital foramen, but on the occipital bone, it was the foramen magnum, okay? Foramen actually came first. So make sure that you are getting the correct order of the words. Saying foramen mental or foramen supraorbital is incorrect, okay? Exactly how we have it on the paper is exactly how you should respond when asked, all right? And then, of course, saying of the regarding which bone it's on. Okay, so that's the mandible, just three little markings: the mandibular condyle, the coronoid process, and the mental foramen. Now, for the maxilla, it's the top portion of the jaw, all right? And there's only one marking that you need to know, and it's called the infraorbital foramen. So this kind of sounds familiar. We had the supraorbital foramen of the frontal bone. Now we have the infraorbital foramen. So still looking for a hole because it's a foramen. And infra is kind of like inferior, so below. And then orbital below the orbital cavity. So we're looking for the hole above, the hole below the orbital cavity of the maxilla. And there are two of them, okay? So these guys here. And that's it for the mandible and the maxilla, all right? So hopefully you guys are still with me. If not, pause it, rewatch from the beginning before moving forward, because it's going to get a little bit more complicated. Okay, so we're jumping over to the temporal bone, all right? Now the temporal bone, there's two of them. They're on the lateral sides of your skull, all right? So we are moving right over here, all right? So the first thing that I want to identify on the temporal bone is the zygomatic arch, okay? The zygomatic arch is this little bridge right here, okay? The zygomatic arch connects the temporal bone to the zygomatic bone. Remember, the zygomatic bone was your cheekbone, okay? So you can actually see the suture line that separates the temporal and the zygomatic bone. So when you're labeling this as the zygomatic arch, make sure that you say zygomatic arch of the temporal bone because it is on this side of the bone. Okay? Next, we have the mandibular fossa. All right, so fossas are shallow pits. All right, it's another bone marking description. Now, like I said, I have an attached mandible here. As you can see, it's attached by this spring. So on the temporal bone, where the mandibular condyle, that posterior extension of the mandible, articulates or connects with the temporal bone, there is a shallow pit right here. That shallow pit is your mandibular fossa of the temporal bone, okay? It's where the mandibular condyle of the mandible sits, all right? And it's also inferior to the zygomatic arch. All right. Now, moving posterior on the temporal bone, we have this opening right here, all right? This opening is not a foramen. It's actually called the external acoustic meatus, all right? That's a lot of words, but we need to say it to be complete. The external acoustic meatus is actually your ear canal. This is your ear, all right? This is how this is how sound moves into your brain, all right? So the external acoustic meatus. You can also label it as the external auditory meatus. I think on some resources it does describe it as either the auditory or the acoustic. Okay, so I will accept either answer of external auditory or external acoustic meatus of the temporal bone. All right, and moving even more posterior, we have the mastoid process. All right, so the mastoid process is that massive process posterior to your ear. Now you can actually feel this on your body. Go behind your ear and kind of feel around. You should feel a protrusion coming down, all right? What you're touching, what you're playing with right behind your ear is this. This is the mastoid process, all right? So that's a fun party trick. You can tell all your friends and when you're able to hang out with them, hey, feel behind your ear. I know what that is, all right? So that's your mastoid process of your temporal bone. Now, the styloid process is something that I want you to actually cross off the list. So one last thing to learn. A lot of our models and even the plastic ones, it's broken off and it really doesn't have that much of a function, so I'm just gonna skip it, okay? So we don't need to know the styloid process of the temporal bone. No. Okay, awesome. So we did all of the external bones and bone markings. Now we're going to go inside the skull, all right? Now remember, there's two bones that we need to know from this view. It's the ethmoid bone and the sphenoid bone. I'm gonna start with the ethmoid, okay? Now remember what I said in the previous video, the ethmoid bone is almost completely embedded by all of these facial bones. And all that we can see is this little rectangle, okay? So what we have, there's only two markings that we need to identify. First, we have that little peak right in the middle of it. This is your crista galli, okay? This whole large portion right here, okay? All of that is the crista galli. On either side of the crista galli are the cribriform plates, okay? Cribriform plates. So basically, you have a mountain, which is the crista galli, and then the land on either side of the mountain are the cribriform plates, okay? All right. So really, that's simple. Basically, everywhere where the holes are going through, that's the plate. So the holes are going through the cribriform plates, Okay. So that's the ethmoid bone. Next, and finally, we have the sphenoid bone. All right. Now remember, we refer to that as a bat. And one of those reasons is, well, yes, it kind of looks like it, but we also have two markings that refer to its wings. Okay. So this portion, the majority of the sphenoid bone that I am outlining right now with my finger, that is these are the greater wings, okay? So the greater wings are the majority of the sphenoid bone, all right? The lesser wings are more anterior, because remember, this is the anterior portion of our face, right, of our body, so they're closer to that, so they're anterior. And you can see there's a little suture line going along here, okay, that little suture line. And then there's these little guys that kind of come down like that, like little vampire fangs, okay? So these little vampire fangs are the lesser wings. And that suture line is separating the sphenoid bone from the rest of the facial bones, okay? So lesser wings are these little guys on the superior and anterior portion of the sphenoid bone, and then the greater wings are lateral and are basically the majority of the sphenoid bone. Okay? All right. Next, so those were the wings of the bats. Now we have the body of the bat. The body of the bat is really just this whole portion right here, all right? And we call this the sella turcica. Sella turcica, all right? It does look a little different on the plastic, and you may find images where it's a little different. That's because on the real bone, it's been broken off, all right? But this guy right here, kind of sitting on the body of the bat, is actually the sella turcica, okay? So, greater wings, lesser wings, and sella turcica. All right. Next, we have two foramens, so two holes to go over, and notice that they say foramen first, okay? So make sure we're keeping the order of the words in check. So first we want to find the foramen ovale. Now the foramen ovale looks like an oval. Oval, foramen ovale. So we're looking for an oval. All right, so we're going to come down, and it's almost on the greater wing, but it's right here. This right here is the foramen ovale of the sphenoid bone. All right, this foramen ovale is your marker to find the foramen rotundum. So this ovale is kind of inferior on the sphenoid bone. From that ovale, you want to move superior into the foramen rotundum, okay? So you're in the foramen ovale, and you move superior into the foramen rotundum, all right? So the foramen rotundum is pretty much under the lesser wing, whereas the foramen ovale is under the greater wing, all right? So there's a couple different ways to recognize these ovales. The last thing that I need to go over for the sphenoid bone is the optic canal. All right. So the optic canal is something that is seen through the orbital cavity, and we can do that. I said not to identify bones through the orbital cavity. However, markings, that's totally fine. So the orbital canal or cavity can show us the optic canal. All right, so basically I'm just going to stick my needle through the eye, and bam, I landed in the optic canal. All right, so this guy right here where my needle is coming out, this is the optic canal of the sphenoid bone. This is where the optic nerve goes through the canal and then goes into the eye, and that's how we're able to see. All of these foramens and canals and markings, they all have a purpose. Either it's moving blood, moving nerves, allowing other bones to move by being shallow and, you know, soft and smooth, or allowing bones to articulate. They all have a purpose, and that's why we have to name all of these markings, all right? So those are your bone markings and bones of the skull.